There are so many great things that the March of Dimes is doing, not only for the families, but also for the kids. You know, these kids are going to grow up into adults, and this is our future, and we really need to make sure that we're giving them the best chance at a healthy start in life.
Once I went into perinatal medicine, I have never looked back. It has been a source of great challenge to me, and also a source of great growth, of great deep satisfaction, and something of a spiritual practice, actually.
No regrets.
No regrets. There have been many times when I've had to deliver very difficult news to families, and I have known that what I was about to say was going to change the course of their lives forever.
This time, instead of just one, we were blessed with two.
Things were going great.
Yeah, it was easy.
Yeah, it was going well. You know, we were getting excited. We kind of just passed the halfway mark, about 21 weeks.
And it just all of a sudden turned for the worst within a matter of just hours. I went from, wow, we hit 24 weeks, to becoming very sick, very ill, like instantly, to the point where they said, we need to take you and have an emergency C-section now, or you could lose your life. Declan was here for one day, and Lucas, we decided after 2 days to let go.
Nothing can prepare you for the moment when you hold your child in your arms and they're lifeless. Nothing. Our son passed away in utero. He was stillborn, and no one could tell us why. We had countless numbers of tests done on me and on the baby, and all came back inconclusive. About a year after the death of our son, our daughter arrived, and she arrived a bit early, and she spent some time in NICU. And NICU is a life-changing experience. There are all these babies. They're as big as your hand, and they're all just struggling to survive. And we knew that we were the lucky ones, and that we were going to be able to bring our daughter home. And we also sadly knew that there were other families there that weren't going to be able to have that same outcome.
A little bit more than a year after the boys had died, that we said, all right, I think we were ready.
Mm-hmm. I carried Kate and Isabel for 32 weeks, thanks to progesterone shots and bed rest and other meds that I was on. And they just said, we need to deliver. They're at a great stage, they're at a great weight. They'll do great in the NICU.
The thing that amazes me when I look at my daughter, there's this vibrant, energetic, amazing little child that I know is going to change the world. And when I look at her, I'm full of gratitude, because I know that years and years ago that somebody just like me and the people who are walking with us in support of the March of Dimes, they reached out and they supported the organization, and because they did, I know that my daughter is here today. We understand the mission of the March of Dimes because we've lived it.
The March of Dimes helped me a lot in terms of my grief. I think it just kind of gave me this positive outlook on, okay, I can still talk about them. This is a safe place to talk about them. People get it and understand it because other people have gone through it or something similar, or maybe they didn't lose a child, but they have sick children, very sick children. And so that's a different type of grief. And so, you know, it was a place for me to feel safe, and it was a place for me to talk about them, and it was a place for me to be doing something good and positive in their name.
I've been thinking about what would happen if a big organization like the March of Dimes all of a sudden disappeared. And especially in our field of obstetrics, this would be a very devastating event. The March of Dimes provides us with research money so that we can move into the future. The March of Dimes provides us with educational opportunities for our physicians. The March of Dimes provides us with a way to get public service messages, and they directly provide public service messages and health messages to the population who doesn't have to go to a doctor's office to hear about folic acid supplementation and some of the other things the March of Dimes promotes. All these things make a difference. Our field, after all, is about making citizens for our future. And this really starts with one family and one child at a time. We are very appreciative and dependent on an organization like the March of Dimes to help us to continue to improve our medical care in the future.
Our story, unfortunately, isn't unique. There are so many families just like us. You can't change my story and the other stories that we hear every day. We can just make sure that the next story has a happy ending.
March of Dimes might be a national organization, but we rely so heavily in the community here for the local support. The amount of support that we do get from the community is phenomenal, but without their help, we would not be able to carry out our mission of making sure that all babies are born healthy. I hope that someday I don't have a job. I hope that, we eradicate prematurity like we did polio 50 years ago. But until that time, we're going to continue to work as hard as we can to make sure no family knows the pain of, having a baby born too soon or too sick. And until that time, with the support of the community and your help, we can do that.